Strategic harmony, applying game theory to cultivate success in good cooperation between HOH and IMSAN, with 4 key behavioral principles. Aruba needs good cooperation between Dr. Horacio Oduber Hospital, HOH, and Instituto Médico San Nicolás, IMSAN. Yet there are many reasons why this is not happening, at least not really. I have thought many times about what can be done to remedy this. In reality, it is all a game, and we should analyze this to find the best win-win situation. Game theory offers a fascinating lens to analyze strategic interactions between entities, including institutions like hospitals. When examining the lack of cooperation between Dr. Horacio Oduber Hospital and IMSAN, a JCI-recognized institution in Aruba, game theory can help identify the best course of action for both. This analysis will explore how game theory concepts like the prisoner's dilemma, cooperative games, and the Nash equilibrium can provide insights into how these institutions can navigate their interrelations for mutual benefit. Introduction. In Aruba, the healthcare landscape features prominent institutions like Dr. Horacio Oduber Hospital and IMSAN, each playing a crucial role in providing medical services to the population. However, the absence of cooperation between these entities poses challenges to their operational efficiency and patient care standards. Analyzing this situation using game theory reveals strategies that could foster collaboration, ultimately leading to improved regional healthcare outcomes. Game theory, an overview. Game theory is a mathematical framework that studies strategic interactions among rational decision-makers. It aims to predict the outcomes of these interactions based on the choices of all participants. The theory encompasses various models, including cooperative and non-cooperative games, the prisoner's dilemma, and concepts like the Nash equilibrium, which occurs when no player can benefit by unilaterally changing their strategy if the strategies of the others remain unchanged. Analyzing the situation, the prisoner's dilemma. The lack of cooperation between Dr. Horacio Oduber Hospital and IMSAN can be likened to the prisoner's dilemma, a standard example in game theory. In this scenario, 2 prisoners, the hospitals, face a choice, to cooperate or to defect, not cooperate. If both cooperate, they receive moderate benefits, improved healthcare outcomes. If one cooperates while the other defects, the defector gains more, potential short-term advantages, such as attracting more patients, while the cooperator suffers. If both defect, both are worse off than if they had cooperated, diminished healthcare quality and efficiency. The importance of cooperation. For healthcare institutions, cooperation can lead to shared resources, knowledge exchange, and streamlined patient care processes. Cooperation can be particularly beneficial in emergency services, specialized care, and research initiatives, improving patient outcomes and operational efficiencies. Game theory suggests that reaching a cooperative solution would result in a Pareto optimal outcome, where no entity can be better off without making the other entity worse. Strategies towards cooperation. To move towards cooperation, both institutions can employ several strategies. 1. Communication and trust building. Open communication channels can help build trust, a crucial step towards collaboration. Regular meetings and joint committees can facilitate this process. 2. Mutual benefit recognition. Both parties must acknowledge the benefits of cooperation, such as enhanced reputation, shared resources, and better patient care. 3. Agreements and alliances. Formal agreements can outline the terms of cooperation, including shared projects, research initiatives, and patient referral systems. 4. Joint ventures. Initiating joint ventures in areas like medical research or acquiring new technology can benefit both institutions. 5. Third-party mediation. In cases where direct negotiation is challenging, third-party mediation can help both parties find common ground. Nash equilibrium. Finding stability. In game theory, the Nash equilibrium represents a state where each player's strategy is optimal, given the strategies of others. For Dr. Horacio Oduber Hospital and IMSAN, reaching a Nash equilibrium would mean finding a balance where both institutions' strategies towards cooperation yield the best possible outcomes for each, without any incentive to deviate unilaterally. Achieving this equilibrium requires recognizing the interdependence of their actions and the potential benefits of cooperation. The role of external incentives. Governmental and regulatory bodies can significantly encourage cooperation between healthcare institutions. Policies, incentives, and regulations that promote collaborative efforts can shift the strategic landscape, making collaboration more attractive than competition. For example, funding allocations for collaborative projects, recognition awards, and joint accreditation processes can incentivize institutions to work together. Conclusion. Through the lens of game theory, it's clear that cooperation between Dr. Horacio Oduber Hospital and IMSAN presents the best course of action for enhancing healthcare delivery in Aruba. By overcoming the strategic hurdles inherent in the prisoner's dilemma and striving for a Nash equilibrium, both institutions can achieve mutual benefits that extend to their patients and the broader healthcare system. This requires a commitment to communication, recognition of mutual benefits, and the intervention of external entities to foster a cooperative environment. Ultimately, the application of game theory illuminates the path toward collaboration and underscores the importance of strategic decision-making in the pursuit of superior healthcare outcomes.